Good morning, all. I profusely thank Dr. G Vijayakumar sir for this wonderful opportunity. Usually, the religions were originated to unite people for a common cause. And it gives them a lot of confidence. When somebody having self-confidence, they can handle all the difficulties by themselves. When they don't have, they need some hold. That's how God and religions were originated. And people feel very much close to the divine power. They feel very much in contact with the God when they are having some rituals. One of the ritual is religious fasting. It is common to all the religions in the globe. You can see the uniformity across the globe, so you can be sure that all the religions were originated from somewhere in one point, like man originated from Africa. Like brothers and sisters, they are fighting with each other. So that is not our focus today. So religious fasting, I have to tell you the difference and similarities between religious fasting and intermittent fasting. Religious fasting, fixed duration and timing, high levels of motivation will be there, and the risk of hyperglycemia and fasting hours and ketoacidosis can happen. And intermittent fasting, this flexible duration and timing, varying levels of intrinsic, extrinsic motivation. And the intersection, we have the risk of hypoglycemia, risk assessment and education is essential before the fasting period. And treatment adjustment is very much required. Let us go to the Hindu fasting. But clinical practice, we are not seeing any Hindu people coming to you, doctor, I am going to do fasting, give your advice for my diabetic management. Have anyone encountered this kind of advice from you? But very rare. Because it happens regularly, they think it can be handled on their own. The calorie restriction or intermittent fasting shown to improve the glucose homeostasis and insulin resistance human, improve the weight loss and cardio protection is there. And there is a good decrease in visceral fat mass, fasting insulin resistance. But sometimes they are after fasting, they are going for binge eating, high caloric diet, high glycemic index diet they used to take, which leads to deterioration of the glycemic status, and there is no weight loss. You can see this after Ramadan. Most of the time they are fasting, they go for feasting, and there is no weight loss. And two entities are there. One is fasting and feeding. They will fast, they will take the basic nutrition which needed for the survival. That is fasting and feeding. And fasting and feasting, what we are seeing with Ramadan and Deepavali, Pongal, all those times. In Hindu mythology, Hindu is a way of life, like Islam is a margam, is a way of life which included so many religions. You can see by Constitution of India it says whoever non-Parsi, non-Christian, non-Muslim are considered as Hindu. That is the Constitution of India, the same applicable here. It is a way of life where we are taking evidence from Vedas, Smritis, and I profusely thank Professor Krishna Sheshatri and Sriram Agadevan sir for their wonderful article about this one. Nirahara, Niragaram, Tamil, Nirahara, without food they will consume only water. Palahara, they will take only fruits and milk. Alpahara, Alpam, Ramba Summa, Chinna amount, Alpahara, broken rice, Tamil, Noikenjin Sulu, Noikenji they used to take. Panchaga, alternative fasting and feasting. One full sabram irukku adutha naal vachu seiyiradu. So at present, periodic fasting and feasting and fasting are the final two entities. Periodic fasting, Ekadasi. They will start the fasting by 10th day, Ekadasi 10th day evening, and they will break the fast in 12th day morning. And Vaishnavist, Saturday. Most of you are not going to take non-vegetarian. Perumaliki niki sabramate. Shaivites, Pradosham, 13th day of every lunar month. They won't take anything in the morning. After all the Pradosha Puja, they will go and take food. And Fridays, all the Ammans, Shakti, Vadivangal, they will fast on Fridays. And Jains, we are included. Previously, they were separate religion. Jains, Samanam, Vainam, were separate religion. Now it is included in Hinduism. They fast on full moon days, 14th or 8th days of the lunar month. And festivals, feasting, fasting and feasting, Navaratri. This is celebration. I want to give my gratitude to the God. I want to celebrate the presence of God with me. So I will fast, I will feast. They're enjoying the Navaratri, 9 days. Deepavali is a high calorie diet. In northern Tamil Nadu, you can see a lot of crowd in front of mutton stalls. Southern Tamil Nadu, I'm not seeing that culture. In Kongu side also, there is not so much of culture like that. But in northern Tamil Nadu, they used to take a lot of mutton. And mutton will not go alone. It will accompanied by good quantity of rice. We know very well. And it should be followed by a Deepavali Marandu. Omam, Milagu, Jeeragam, Tippili. So many ingredients are there that should be taken after the feast of Deepavali to reduce the toxic effects of the high calorie diet. Are we taking Deepavali Marandu? I don't think so. So Pongal, when Pongal, Chakra Pongal. When Pongal focusing on salt and Chakra Pongal focusing on the sweet. So we are waiting very much. So what about the counseling? Every pre-festive session, if at all the patient come to you, a Hindu patient come to you asking for your advice, or we have to make them, we can place a pamphlet in front of our waiting hall, so make them realize that some advice is needed before fasting. So diabetic patient with poor glycemic control, HbA1c more than 9, recent history of ketoacidosis, established micro and macrovascular disease, severe associated comorbidity, infections, pregnancy, elderly people, we have to tell them, sit with them, advise them to avoid fasting. It is a very difficult situation to preach somebody go against the God. They will feel more connected. They will feel guilt if they are not fasting. Actually, you should not play with the faith of anything. Whatever science says is different. What is the faith? 100 to 400, definitely. Highly concentrated, high glycemic index food they are taking. That is iftar. So we have to advise them to reduce the sugar containing drinks, particularly that kanji and that sweets, and reduce the portion of food. And suhoor, full grain food, because they are having full grain. Even our people used to take all the sirdhaniyam, made it to powder, and they will take. So kanji kudicha, they are not realizing that it will very fastly, it will increase the blood sugar levels, whatever may be the material. Varagu, Kambu, Solam, Kudravali, Karpu Gavani, Sapu Gavani, whatever it is. So all they are having already 65 to 55% of carbohydrate in that. They are having little bit excess of fiber when compared to rice. So when you consume them whole grain, then only the benefit of fiber will help the patient. So ask them to take full grain food. So drugs during Ramadan almost similar to our Hindu religion. If you want to change metformin dosing during Ramadan, once daily dosing, already they are on once daily dosing, no dose modification is will required, take at iftar. Twice daily dosing, no dose modification, take at iftar and suhar. 3 times daily dosing, combine afternoon dose with dose taken at iftar. Madhyanathiyum, Sayandrathi Seti, Sayandran Kurtala, Kalil dose, Kalil Kurtala, over. Prolonged release metformin, no dose modification, take at iftar in the evening. The sulfonylurea, sorry for the congested slide, sulfonylurea and glanites, once daily dose, take at the sunset meal, not in the morning, because you are going for feasting, sulfonylurea will not do any hypoglycemia in the early morning. Once a day. Twice daily dosing, consider decreasing the morning dose by 25 to 50%. You can, as usual, night dose can be given as regular thing. Evening dose unchanged at sunset. Incretin, sodium glucose transport inhibitor, thiazolidinediones, alpha glucosidase inhibitor, most of the time doesn't need any dose modification, but you should have caution with SGLT2 inhibitors alone, because they can give you bit of dehydration. And insulin, rapid short acting insulin, no 1 minute sir. No changes to iftar dose, skip lunch dose, reduce suhar by 25 to 50%. Once daily basal insulin, reduce by 15 to 30% of the regular dose, give at iftar in the evening. Twice daily basal insulin or NPH, no changes in the morning dose, but give the morning dose in the evening. Give the morning dose in the evening. And reduce the evening dose by 50%, inject at the before sunrise. Morning dose should be given in the evening, and evening dose should be given in the morning. And pre-mixed insulin, no changes in the morning dose, inject at iftar, same thing. And reduce sugar dose by 25 to 50%. So when the patient decided to go for a fasting, whether it is Ramadan, Hindu fasting, Lent holidays, a Jain religious fasting, whatever it is, assessment should be made by the doctor, and risk stratification as per the scale, IDF scale, and they have to educate, counseling should be given, when to break, when to stop. They have to be explained about the symptoms of hypoglycemia, hyperglycemia and osmosis, osmotic diuresis, all those things, and they have to check their blood pressure and lipids, and we have to follow the patient closely with advice of SMBG. Thank you so much for patient listening. Thank you.